Welcome, everyone. Thank you for joining us today. My name is Kerry Grady Vincent, and I'm the Senior Manager of Scientific and Clinical Programs at Osteoporosis Canada. I will be your moderator for today's webinar, How to Get the Most Out of Your Doctor's Appointment. Before we begin, Osteoporosis Canada acknowledges the land that our offices, located in Toronto, are on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. At Osteoporosis Canada, we educate Canadians about bone health, including healthcare professionals and their clients. We are the only national organization serving people who have or are at risk for osteoporosis. We are excited about today's presentation. We know that with a diagnosis like osteoporosis, going to medical appointments can be overwhelming. What type of questions should you ask? What information should you bring with you? Also, what can you expect from your doctor during your visit? And how should you manage your healthcare appointment? Our speakers today will share their advice on navigating a diagnosis of osteoporosis. Today's presentation is not intended as individualized health advice. If you do have questions about osteoporosis, please consult your healthcare provider. If you have general questions during the webinar, remember to click the question and answer button on your screen to submit your questions, and we will try to get to as many as we can, time permitting. Before we begin, make sure you have your speakers turned up fully so that you can hear the presentation clearly. And it is now my pleasure to introduce our speakers, Dr. Adrian Lau and Mrs. Jackie Herman. Dr. Adrian Lau completed his medical training at the University of Toronto and is currently an endocrinologist at Women's College Hospital. He is an assistant professor of medicine at the U of T and is active with medical education at both the undergrad and postgrad levels. Dr. Lau is a member of Osteoporosis Canada's Scientific Advisory Council, serves as the medical advisor of the Canadian Osteoporosis Patient Network, and chairs the Osteoporosis Canada's Rapid Response Committee. Jackie is a wife, mother, retired teacher, and volunteer who is enjoying life in rural Nova Scotia. She holds a Bachelor of Music and Vocal Performance and an elementary teaching certificate from the University of Victoria, as well as a Master of Education in Educational Psychology from the University of Alberta. Currently, Jackie volunteers with the Nova Scotia chapter of Project Linus, making blankets for children and youth experiencing a crisis, and is the executive chair of Osteoporosis Canada's Canadian Osteoporosis Patient Network. As a person living with osteoporosis, Jackie hopes that sharing her story will help others live well and live safely with this disease. So without further ado, please welcome Adrian and Jackie.
Thank you so much, Kerry. It's a pleasure to be here today. I vividly remember the moment my family doctor told me I had osteoporosis. Suddenly, I felt like I was underwater. Flooded with emotion, I couldn't hold back my tears. Wasn't I too young at 57 to have osteoporosis? I thought this was a disease that only impacted very old people. I always ate well and exercised regularly, so how could this be? I felt angry, scared, completely overwhelmed. In hindsight, if I could have had a conversation with my younger self, I would have said, take someone with you to your appointment. Let this person ask questions and even write down answers. Let them advocate for you if you need help. You and your advocate can revisit what was said at your appointment when you are ready and able to listen. Many weeks after my diagnosis, I returned to my doctor with questions. I wanted to know everything about this disease. How did this happen? What did I do wrong? What did this mean for my future? I went on and on. I think I overwhelmed my doctor, given the amount of time allotted to my appointment. Returning to my conversation with my younger self, I would have said, pick the 5 questions you most want answered and bring them with you to your appointment. Making an extensive list of questions you want answered is great, but you don't need to have them answered all at once. Consider grouping your questions into smaller chunks or categories for specific appointments. Think about what you are ready to learn. And don't forget to bring a pen to write down answers beside the questions. 6 years ago, my doctor suggested I visit the Osteoporosis Canada website. I've been reading, watching, listening, and learning ever since. 3 years after my first visit to the website, I discovered a virtual support group in my region. The pandemic was still with us, and I live in a rural area, so having the ability to participate virtually worked really well for me. My group is overseen by a highly skilled facilitator, and it gives me the opportunity to learn from others who truly understand what I am going through. In my most recent conversation with my younger self, I would have said, join the Osteoporosis Canada support group in your region as soon as you feel ready to reach out to others. One of the many valuable things I learned from this group is the importance of building a personal support team to help me manage my osteoporosis. My family doctor is indeed one of my team members, but there are others who also help me live well and live safely with this disease. My naturopath, pharmacist, physiotherapist, support group members, my loving husband, family, and perhaps most importantly, me. It is up to me to take what I've learned from my team and put it into practice in my daily life. I am the one who needs to make time in my day to do my strengthening and balance exercises, to make sure I'm getting enough calcium and vitamin D each day, adjust the way I do everyday activities like putting on my shoes, sweeping, or vacuuming to make sure they are safe for me. I need to ask for help when I need it, stay organized in terms of my medical history, tests, x-rays, and anything else that I may want to share with my team. And I need to keep learning. New research is always being done, and Osteoporosis Canada can provide you with reliable information about this disease. 6 years ago, I was diagnosed with osteoporosis. Today, I am fully participating in my doctor's visits and in managing my own health. The path hasn't always been easy, and sometimes I still get scared. But every small step forward is something to celebrate. If you have osteoporosis, may you find your path to living well and living safely with this disease. And may you build a team around you so you don't have to go through this alone. Thank you.
Thank you, Kerry, for the introduction, and thank you, Jackie, for sharing your story. I'm just gonna share my slides. So good morning, good afternoon, wherever you are in Canada, or maybe even outside of Canada. I'm Adrian Lau, an endocrinologist, as Kerry has introduced me. And in this session, I want to help you to get the most out of your doctor's visit. Okay. So as a doctor, I have my agenda. When I see a patient in the clinic about osteoporosis, and when I talk about the doctor's agenda. It may be your family doctor, it may be a specialist doctor, it may be a nurse practitioner. So whoever it may be that is taking care of your health or your osteoporosis. And then you, as a patient, you may have your agenda, your questions, and it may not just be a patient. In the context for this presentation, when I say patient, it may mean a person who's living with osteoporosis. It may be a family member, maybe a friend, supporter, or ally to someone who has osteoporosis who wants to support the person with osteoporosis. So many times the patient's agenda and the doctor's agenda, they're not on the same wavelength. They're separate. And then you may spend a lot of time telling the doctor something that maybe they're not so interested in. And then the doctor's asking you questions which you're not prepared to answer. So, but sometimes there may be some intersection and you may find some common ground. But the goal is to realize each other's agendas so you can be all on the same page, so that with the time allotted for your appointment, you can get the most out of your appointment, so that your doctor or your healthcare professional can help you with your managing your osteoporosis. So patient's agenda. What is your agenda? What may be on your agenda? Maybe you want to learn more about osteoporosis. Maybe you want to discover ways to reduce the likelihood that you will experience a fracture or another fracture. How can I optimize my bone health through lifestyle factors? Or maybe you want to learn more about medications for osteoporosis. So we do want to make this interactive. So I think in the Q&A or in the chat, you can type in whatever comes to mind so that I can understand what your agenda items may be. So the question is, what may be on the top of your agenda list when you speak to your doctor about a new osteoporosis diagnosis? So the chat box is there. You can post it and we can take a look. We will give 30 seconds, a couple of minutes. You can just post up what might you want to know? What is on the top of your mind when you go to your doctor or your specialist or your nurse practitioner, when you just learned that you have osteoporosis?
Adrian, while you were waiting to get responses in, I was just thinking something for me when I was newly diagnosed was to try and discover which physical activities were safe for me to do. That was on my mind.
Yes, a very common question, because many people want to exercise and already exercising, but then now, which one should I do and how can I do them safely? That's a very good question, because not all activities may be the same or as effective or safe. Just some responses here. I'm reading out: medications, reducing risk for another fracture, reducing fracture, exercise. Yeah. What's the number one thing I can do now? What can I do? So how can I reduce the fracture risk, reduce the risk of fractures? How can I avoid taking medications? So some optimizing lifestyle things. Yeah, other activities, kayaking, golf. Yeah, as you mentioned, Jackie. What can I do naturally? Lifestyle things, the different degrees of osteoporosis, concerns about medications, side effects, interpreting bone density numbers. So yeah, excellent. Thank you for everyone for chiming in. Some of these things overlap in these categories, but also gives me a bit more insight into what other people are thinking about. Okay, thank you. And thank you, everybody. And thank you, Jackie, for chiming in. Okay. So that's the patient's agenda. That's your agenda. What is my agenda? What is the doctor's agenda? Is it simply to give you medications and write a prescription? No. My agenda is not simply to give you a prescription, give you pills, and off you go. No, not at all. So my agenda as your doctor for osteoporosis would be to assess your fracture risk. And then after that, what can we do together to reduce your risk of having a fracture or another fracture if you have had one already? So the topic for today: how can I get the most out of my doctor's visit? So the number one answer for a patient is to be empowered. To be empowered. What does that mean? So WHO defines it this way: a process through which people gain greater control over decisions and actions affecting your health. So you want to be in control. And then that's through decisions and actions. So how can we do that? How can we achieve that? So 3 things that the WHO has listed: participation, knowledge, and skills. So we'll go through these in turn. And this is taken from one of the WHO documents, actually extrapolated from their document about hand hygiene promotion, but it's also applicable to other situations about empowering yourself. So participation, how can we increase our participation? So being involved in the process with our own healthcare. So we could do that by knowing the historical background about our own health, have self-interest and motivation for a beneficial outcome. And then thirdly, being physically present at all times during care and treatment. So let's focus each in turn. So historical data. So again, our agenda, the doctor's agenda: assess your fracture risk, reduce your fracture risk. So what information would be helpful? What information would be helpful for your doctor to help us understand your fracture risk, and then afterwards to reduce that fracture risk? So information we want: history taking. So you spend a lot of time mostly probably talking with your doctor. Maybe there are forms to fill out beforehand, either by paper or on the computer. There's a physical exam usually, and then sometimes there are results, be it blood tests, bone density, x-rays. Maybe there's some old notes, old reports that may help contribute to it as well. So let's focus on the historic background, or just the talking parts with your family or with your doctor when you talk about osteoporosis. So what questions may your doctor ask you that would be important? So these are the categories I've listed here, and we'll go through these in turn. Your past medical history, some things about your diet, supplements you're taking, activities you participate in, medications, family history, fractures, and falls. So the most important thing here is to know yourself, so then you can share with your doctor about this information, because your doctor may or may not have all this information about you. So past medical history. So here it's important for you to know what diagnoses you may have. You may have that as a list. You may have that from previous hospital records. Maybe your family doctor has been keeping track of a list, and then your family doctor can print a list for you. But particularly to your doctor taking care of your osteoporosis, why do we care? Why do we want to know? Because certain conditions can predispose you to lose bone quicker, or predispose you to have more fractures than other people. It could be endocrine conditions. Certain hormones, too much or too little, can cause us to lose bones quicker. Rheumatologic conditions. So these could be arthritis, rheumatoid arthritis, lupus. So these are immune conditions and inflammatory conditions. And the inflammation sometimes can lead to bone loss. It could be GI conditions with the intestine, with the stomach. Again, that may be inflammation of the bowel, inflammatory bowel disease. It could be certain malabsorption disease, maybe celiac or other malabsorptive issues. Maybe after surgery, you may have been told that you may not be absorbing certain nutrients as well. And it plays a role in osteoporosis, because you may not be absorbing the calcium and the vitamin D that you're taking regularly, and then as a result can impact your bones. Any history of malignancy, cancers, and treatment for them, those can also severely impact your bones. So with regards to your past medical history, if you have a list of things that you've been diagnosed with, maybe even when you've been diagnosed with each of these conditions, very helpful to prepare a list for yourself as well as for your doctors. And maybe it's a list from your family doctor. They have a kind of a summary of all your health conditions. If you have been admitted to hospital recently, they usually may send you home with a discharge summary, which may list all your conditions as well. So those may be helpful lists to bring to your doctor when you see them. Moving on, I'm also interested in your diet. What are you taking in terms of particularly calcium? calcium, because we know that calcium is very important for your bone health, because we want to see if you're getting enough calcium in particular. Trying to assess how much calcium you're having through your diet is important. And you can take a gauge as well. You can see what types of foods have good calcium in it. One important link here, osteoporosis.ca with the nutrient calculator. You can take a look at how much calcium you may be taking in your diet as in addition to some other nutrients. So dietary calcium is very important, but we understand that lots of people take supplemental calcium as well. So you may know what doses you take. So take a look at this example. This has calcium 1200 milligrams. Our recommendation, we say maybe up to 1200 milligrams. So you take one of these tablets and you think, good, I'm taking 1200 milligrams. But take a look at the back, take a look at the fine print. We may think you're taking 1200 milligrams from one of these tablets, but on the back, the small print, which is sometimes too small for us to read, it says, take 2 soft gels. And with 2 soft gels, then you would get 1200. So actually, when it says per soft gel, each soft gel only 600 milligrams. So a little bit misleading. You think that you're taking one pill and you're getting 1200, when indeed one pill is only 600. Mind you, 600 may be enough already, because food, dietary calcium is the more important part of where you should get your calcium, but very misleading. So if you take calcium or any other supplements, read the labels carefully, but better yet, maybe bring the bottles or take a picture of the labels, including the back, to show your doctor, so then we can understand how much you're taking. So bring your bottles, look at the labels very carefully. Some of them could indeed be very misleading. So Osteoporosis Canada recently released new guideline, as many of you would know, just last October. And with regards to calcium, the guideline between 1000 to 1200 milligram, depending on your age. But diet is preferred. If we can get enough from different foods, be it dairy or non-dairy, and we meet our daily requirements, then there's no need to take supplements, be it pills or liquid or anything like that. However, if we cannot eat enough, then supplements can be considered to get enough. Other supplements that are important, vitamin D. Vitamin D is the key vitamin that's important for bone health. There's so many forms. You may get it in a pill. You may get it with your vitamin D. You may get it in a drop. You may get it in a multivitamin, gummies, lots of things. Again, sometimes it could be misleading. You want to let your family doctor know, or your specialist know what's the dose you're taking. Usually the standard dose is IU, which is international units. However, sometimes they may just say MCG. How much is 25 MCG? So it's 1000 international units. Fortunately, this one labeled in both ways, but in other situations, they may be only labeled in one way, which we need to do a little calculation to figure out. So again, bring your bottles, be aware of the units that they're in, and also again, take a look at the fine print. From the recent guideline, the recommendation of how much we should get each day based on Health Canada's guidance, between 600 to 800 units per day. We probably would not get enough through our foods or through sun exposure, and we don't recommend sun exposure as the primary way of getting our vitamin D. So we do suggest a supplementation of at least 400 units a day, just because we're Canadian and we live in this wonderful country. However, you may need a lot more, and that would depend on your vitamin D level, that which may be checked with your doctor. So, but at least 400 units would be the recommended, just as a general recommendation for everybody. Yeah, certain individuals, if they have other risk factors, certainly may need more, and this would be a personalized recommendation based on your situation. We talked about calcium, talked about vitamin D. What other things may be important for bone health that you may or may not be taking? So we recognize that protein, vitamin K, magnesium, all of these are important for bone health. And some of you may be taking some protein supplement, vitamin K, magnesium. These are supplemental. protein, vitamin K, magnesium. Of course, you're getting all of these through your diet as well. Again, to see how much you're getting in your diet, the nutrient calculator from osteoporosis.ca can help you figure out how much you're getting. In terms of how much you need, these are the recommendations again from Health Canada. With regards to our recommendation from Osteoporosis Canada, there's no need for supplementation if we're eating well. So average Canadian diet, we should probably be getting enough of all of these, the protein, vitamin K, and magnesium. Again, you can take a look at the nutrient calculator to see if you have enough. And if not, then you can talk to your doctor about if you need a supplement or not. But better yet, to maybe reassess your diet to see if you can get more and get enough through your diet before considering a supplement. But no recommendation to go with a supplement right away. But if you're taking any, for sure, bring these to your doctor's attention. Okay. Moving on to activities. We all know that activities, exercises are good and important for our bone health. So whatever exercises you do on a regular basis, be it going to the gym, be it going to the mall and walking around every day, or online classes, in-person classes, let your doctor know, because these are important. Particularly with the new guideline, we're focusing on balance and muscle strengthening activities. So in preparation of telling your doctor about what activities you are doing, take a look. So this osteoporosis.ca, Too Fit to Fracture, this is one of our handouts there. It will remind you what activities we consider to be balance activities. Could be Tai Chi, it could be doing other things to work on your leg muscles. Muscle strengthening, it could be working out at the gym with weights, but it could be doing other activities at home to strengthen different muscle groups. These all have evidence to showing to reduce the risk of falls and hence reduce the risk of fractures. So yeah, take a look at these, and you may be doing a lot of these already, so that when your family doctor or your specialist doctor asks you, are you exercising, are you doing activities, then you can kind of let them know what you are doing. Moving on to medications. So if you're taking any prescription medications, it would be important to let your doctor know what you're taking, so the name of it, the dose of it, and how often you are taking it. So you may have a list of medications. Maybe that's from your pharmacy. Maybe you have these medications in a blister pack. Maybe you have the bottles or the boxes. These would all be important to bring to your doctor, so that they can know exactly what you're taking. Because in case they want to assess, give you a new medication, or consider if any medications are at risk of bone loss, then they can quickly figure that out if they know exactly what you're taking. Sometimes my patients may have their medications in a pill box in their purse, and then just bring it out and show me all the pills. But unfortunately, just looking at the pills without the labels, quite difficult for me to identify exactly what those are. A pharmacist would have be much more skilled in identifying the medications by how they look, but for me, maybe a bit more difficult. So if you have a list, if you have the blister pack, do bring them to your doctors, because some medications can cause bone loss, and if we know that you're on them, then we can see how we can reduce that risk. In particular, what medications should you be aware of and particularly pay attention to? Prednisone. Prednisone is a steroid, it's a pill. There are other forms of steroid that you may take, maybe by IV, maybe by other forms. People may take it to reduce inflammation, maybe because of inflammation in the lungs, inflammation in other areas. So an important medication, but one side effect is that it may cause bone loss. Some people may take it for a long time, some people may take a short time, but a high dose, a short duration, and you taper it off quickly. So if you've been on these, then do let your doctor know and how you've been taking them, what schedule you may have been taking them. Two other medications which are important in terms of how it affects bone health are cancer-related medications. aromatase inhibitors, which are used for treating breast cancer, and androgen deprivation therapy used to treat prostate cancer. These medications reduce the estrogen levels and the testosterone levels, respectively, in your bodies to reduce the risk of cancer coming back. Very important. However, when you reduce estrogen and testosterone, it may have negative effects on the bone and may cause bone loss or maybe even fractures. So if you are on these medications, even before, do let your doctors know, because that may play a role into how we reduce your fracture risk and manage your osteoporosis. Yeah, so bring to your doctor's attention, if you know these medications by name, what the doses were, the duration, how long you've taken them, very important, very important. So moving on to osteoporosis medications, maybe by the time you're seeing a specialist, lots of time people who see me, they're already on a bone medication started by maybe the primary care physician. So if you're on these medications, even before, maybe 10 years ago, if you remember them, maybe make a list of them. Which medications have you been on? How long have you been on them? Did you have side effects while taking them? Because just because you've been on them before doesn't mean you cannot be on them again. Lots of times I ask my patients, were you on this medication before? Did you tolerate it well? And if you tolerated it well, maybe we'll try that one again because we know that you tolerated it well. However, if you did not tolerate it so well, then it will probably have me looking at other options as opposed to giving you something which didn't give you a good time while taking it the first time. And if you are on these medications and they were stopped, then try to remember why they were stopped. Was it because of side effect? Did you take them for too long and your doctor told you to stop? Very helpful information in deciding what the next steps may be. So in particular, if you're taking pill medications, these are bisphosphonates, two different brands. Just tell your doctor how you're taking them. So your routine, how often are you taking them? Some of them are once a week, some of them once a month. The older forms are still available, which are once a day. Do you take them with food, without food? When do you take them? In the morning, in the evening? How often are you taking them? And are you having side effects? So the common ones, which some people may have, are GI symptoms, abdominal symptoms, and maybe flu-like symptoms. Because if you have some symptoms with one of them, sometimes they may get better with time. Sometimes if we change the brand, if we change the dosing frequency, some people may tolerate it better. So if that may be the issue, then your doctor may have some strategies into reducing those symptoms. Some patients may be on the injection, denosumab, or also known as Prolia. So for this one, very important to let your doctor know how often are you getting it. So very important to get it on time, every 6 months without delay. And also important to know who's giving you the injections. It may be your family doctor, maybe a nurse, it may be a pharmacist, maybe it's yourself or your family member, and that's okay too. But if you have this information, do let your doctor know, very important. Moving on to another category, talking about family history. So family history of any medical conditions, but in particular, when we talk about osteoporosis, if you know of anyone in your family with osteoporosis, with fractures, very important to know. Maybe you know that maybe they're on medications for osteoporosis. Sometimes in some families, they may not talk so much about their own medical history, but if you know someone that's been on medications, that you can infer that maybe they have osteoporosis. In particular, when they did research to figure out what confers the highest risk for you in terms of family history, and that one is actually a parental hip fracture. If your mother or father had a hip fracture, that may infer a higher risk for yourself to have fractures. Maybe not the hip, but just any fractures. So that's if you know that particular, to let your doctor know, because that may play a role into assessing your fracture risk. If it's in the unfortunate event that you have had a fracture already, and you had a fracture already before knowing that you had osteoporosis, and then came to the doctor's attention about osteoporosis, then it's important to let your doctor know about the fracture or fractures that you have had, because not all fractures are the same. Sometimes people may have fractures in accidents, maybe in car accidents, maybe workplace accidents, and we consider these fractures not a fragility or not an osteoporosis fracture because of the high speed or high impact or high height you fell from involved. However, other fractures, which usually we consider fall from standing height without great speed, and those we consider to be osteoporotic or fragility fractures, and that may play a role for us to assess your fracture risk. So if you have had fractures, try to remember which bones you broke, when you broke them. So maybe they were recent, maybe they were broken when you were a child, 4 years old, 6 years old. So that may not play such a big impact, maybe 60, 70 years later. And also know how you fracture, so the mechanism of fracture. What was going on? Was there speed involved? Did you fall from a higher height? And the mechanism of fracture as well. Related to fractures, lots of fractures associated with falls. So are you at risk of falls? That's one of the jobs that your doctor will do. Some of the questions that you may be asked: how many times have you fallen in the past year? And then what were the circumstances around these falls? Were it just slip and fall? Was it the environmental conditions, slippery ice, or maybe hazards at home, be it extension cords, pets, children's toys in the home that may be tripping hazards. So different situations may be leading to the fall. So remember the mechanism of the falls, because there can be certain things that can be done to reduce your risk of falls. So we talked about the history taking. That's the information that you can provide to your doctor. Sometimes your doctor may have access to old notes from other hospitals, depending on the province or territory you're from. But sometimes the computer systems are not talking to each other, and they don't have any information about you except for what you bring to the doctor. So very important for you to provide the accurate information about yourself to your doctor, so that your doctor can help you. Next, results. So did you have any blood tests, urine tests, imaging studies? Those will also be helpful in assessing your fracture risk. So how do we ensure that your doctor has all your results? Some of it may be available electronically. Some of them, if you're seeing a specialist doctor, may have been sent by your family doctor to the specialist, but sometimes they are missing. So how can you go about helping your doctor get all this information? That sometimes is a headache for yourself and a headache for me as well. When my patient's sitting in front of me and then we say, did you have a bone density? Like, yes. Where's the result? Nobody knows. And then we're kind of scratching our heads, don't know what to do. So if you have results and reports, do bring them in, lots of patients, they keep a record, keep a binder of all their information, and then they can just bring it to your doctors, but they never let me keep it, so that they keep the report. They may let me make a copy of it and upload it to our system, but they always keep a full record of their own reports and results. Any old lab results, blood tests, you can get access to. If you have previous X-ray reports, bone density reports, bring them in. Your doctor may have it already, but if you have an extra copy, okay. But if they don't, then you'll be supplying some missing information as well. So my recommendation is keep a record of all your records, because they belong to you. So you can sometimes ask the hospital to release your information to you. Whichever place you went to do X-rays, bone density, they can release that information to you as well. Sometimes they may give you the report that was generated. Sometimes they may give it to you electronically, maybe a CD or DVD, maybe not so much anymore, but maybe on a USB key. And sometimes they may be able to send it to you electronically, or give you a link to your email or text or whatever, so that you can kind of go online and download your own report and download your images. So if you have access to get your results, that will be important, because you can supply that to your doctor when you go to see them for the visit. Okay, next, after we assess a person's fracture risk, of course, we want to reduce that fracture risk. So how can we do that? We talked about patient participation. We talked about getting the historic background information. So next, we want to talk about self-interest and motivation for a beneficial outcome, and being physically present at all times. during care and treatment. So what does that mean? What does that mean? So in most situations where the patient's agenda intersects with the doctor's agenda, we're in agreement. We want to optimize lifestyle things, not the medications part, but lifestyle, be it calcium, vitamin D, other nutrients, and physical activity. I think we're all in agreement with that. We want to manage risk factors of accelerated bone loss. Whatever's causing us to lose bones quicker, we want to reduce that risk. Sometimes with regards to medication pharmacotherapy, sometimes your doctor may suggest medication and you may be hesitant. You may have second thoughts and reservations about starting a medication. And sometimes that there may be discrepancies about what your doctor suggests and what you may want. So how do we be empowered? How do we be empowered? We can be empowered through knowledge, gathering enough information, understanding how to use the information, be convinced that this knowledge would give you shared responsibility with your healthcare provider. So, of course, this is knowledge with respect to osteoporosis and maybe even medications. Maybe just stop right here for 1 second. Maybe I'll call on Jackie, because she can share some insights that she has as a person with lived experience with osteoporosis about patient knowledge.
Thanks, Adrian. I think firstly, what I'd like to tell everyone is it's really important to be patient with yourself, because for me, this has taken time gathering this information. So you find your sources. So for instance, for me, Osteoporosis Canada has been my rock. That's my go-to place where I know I can depend on that information. So I continue gathering information, learning, growing in whatever ways seem right for me, and also in the way that I'm ready for. When I was first diagnosed, I wanted to learn everything all at once. And honestly, it just overwhelmed me. So since then, I've learned to kind of put things in categories or just take it slower. It also takes, I guess, time to develop confidence in this ability to share responsibility with your healthcare provider. So again, I think patience is the key. Getting information that you can trust. And I know on the Osteoporosis Canada website, there's even there's articles. I think there's a podcast or a webinar also on how do you find information that you can trust. So those would be my main points, Adrian. Back to you.
Okay, thank you. Thank you for your sharing, Jackie. So as Jackie mentioned, gathering information, how do we get information that we can trust? Is Dr. Google a good source of information? So this is cartoon here. I recommend real doctors. I stay away from getting a second opinion from Dr. Google. So the internet is a wealth of information, but not all information is maybe good information. So beware of information from the internet. And with regards to osteoporosis, I would recommend your starting point be Osteoporosis Canada's website. This is the page on treatments, on medications, but there's lots of information about other aspects of osteoporosis, be it managing risk factors or diet or nutrition and physical activity. Many articles there that can be your starting point, would be a well trusted source of information. So you're getting your information, you're increasing your knowledge, but you still may have questions. And it's okay to have questions, a lot of questions. So be prepared. Prepare a specific list of questions that you may have. As Jackie mentioned, you may not have all these questions answered at one time or at the first visit. You may have too much to talk about. So you may prioritize to see what you want to focus on. Maybe you have questions about calcium. How can I get enough without supplements? What about dietary restrictions or dietary intolerance? I can't tolerate dairy products. Can I still get enough from food? Vitamin D, do I need supplements if I'm in the sun all the time? The vitamin K, magnesium, protein, do I need supplements from these? How do I get enough from your food? And then activities, and some of these were kind of brought up in earlier this session about your agenda items. Can I do certain activities? Can I golf, ski, do yoga, Pilates. What can or cannot I do at home, keeping safety in mind? So ask what's most important to you. You may have questions about your medications that may be suggested. Again, what is important to you? What would you like to know before starting or deciding on a medication? Maybe, do I really need it? How long do I need to take it? Side effects and cost. So I'll take a pause right here, and maybe we'll take a poll. And thank you, Roy, for putting up the poll. So I want to get a sense from the audience. What is most important to you when starting a new medication? What is your number one question or your concern? Is it how well does it work? How long has it been around for? Is it brand new, or has it been around for 20 years? Side effects, maybe short-term side effects, long-term side effects, maybe cost, maybe it's not covered by the government plan, or maybe you don't get coverage from the government yet. How about the route of administration? Is it pills? Is it injections, infusions? Okay. Okay, maybe let's see the results, then we'll share the results and share these results with everyone. Thank you, Roy. So kind of an even split. So half of you answered, how well does it work? So of course, we don't know how it works. And then 51%, a little bit more than half, concerned about side effects. Yeah, very common concern. Thank you. So there was a study done a few years ago. Unfortunately, they only asked women, and we know that osteoporosis does not only affect women and men as well, and of all ages as well. Nonetheless, they asked women about values and preferences with regards to osteoporosis treatment. So they highly kind of ranked efficacy, effectiveness, how well it works, and adverse effects. So side effects. So same as a poll, these two were the number ones equally, and 45 versus 51%, pretty close on our poll as well. And then some other things that were brought up in the survey, did they rather have pills, did they rather have injections, cost, duration? So yeah, we're seeing similar things. So whatever it's most concerning to you, do bring it up with your doctor. So prepare specific questions. It's okay if you don't, and it's okay to not remember all your questions at the first time, because you may have follow-up visits. It's okay to ask at a later time. Just write them down and ask at a later time. That's okay too. Lastly, after participation, knowledge skills, patient skills. So what does patient skills mean? Maybe self-efficacy. Individuals believe that he or she has a capability to produce an effect or reach a certain goal. Maybe health literacy. So we're looking for information, trying to gain more knowledge. How good are we in understanding the health information in order to help us make decisions about health and medical care? So maybe for a couple of minutes, I'll just kind of draw on Jackie's expertise here again to share with us maybe a little bit about patient skills.
Thank you, Adrian. And again, I found over my experience that being patient with myself and realizing that this is not, I'm not going to get this all together at once. If we can accept that in ourselves, it really makes.
Okay. Thank you, Jackie. I think there's some connection issues. I think Jackie just dropped off a little bit. But yeah, so
I think, oh, sorry, Adrian, I did get kicked off there a little bit, but I seem to be back right away, so that's wonderful. The other thing I was going to say about self-efficacy is not all of us always feel really confident. And so I think what's helped me is when I'm thinking of going in to see my doctor, or whether it's another member of my support team, if it's something that I'm kind of shy talking about, or that I think I might have difficulty speaking about, I actually practice and rehearse it before I go. And I really find that that helps me build my confidence. And in terms of health literacy, one tip I have is as you go through your records, your reports, whatever it is, as you're reading online, however you're getting your information, I actually found it very helpful to create a list of acronyms that are frequently used. And I just made a document on my laptop to help me so that as I'm reading, I keep it beside me. And so I'm not constantly saying, what does that mean? It's just another help. Thanks, Adrian.
Thank you. Thank you for sharing, Jackie. Okay. So we're wrapping up soon. So just a reminder, the doctor's agenda is not to just simply give you medications, but really to assess your fracture risk and then subsequently to reduce that fracture risk. So we talked about being empowered to make decisions, and we need to make informed decisions. So that's about patient knowledge and patient skills so that you are able to make a well-informed decision. It's not a decision that your doctor is making for you, but usually the doctor would want to help you make your best decision. So making a decision, ensure that all your questions are answered. If you're not ready to make a decision, then you're not ready. Then you may need more time, and that's okay. Ensure that you have all the information you need before deciding. And if your family doctor or your specialist say, oh, you need to start this medication, it's okay to say no. It's okay to be indecisive. It's okay to take time to think, take time to get your questions answered. Maybe you don't have the questions right now to ask your doctor. Maybe you want to ask someone else. That's okay. You have time to decide. You have time to decide. So okay to ask for help. So maybe you're going to schedule a follow-up visit for the same doctor to ask. Maybe you want to ask other people, pharmacists, physiotherapists, occupational therapists, maybe talking to other people in Osteoporosis Canada, as we talked about, support groups or signing up with COPIN. We have newsletter articles coming out through the email group. So that's all different avenues. You can get more information if you have questions that are left unanswered. Remember, you don't have to decide until you are ready to. So I know we're running short on time, but we can maybe run this quick poll, Roy. So the last question, who are you most likely to turn to when you want more help, more information for your osteoporosis? Could it be a family member, a friend, back to your family doctor, your primary care provider, your specialist doctor? Maybe talking to your pharmacist, you have questions about medications. Maybe physiotherapist, you have questions about exercise. Maybe it's your naturopathic doctor. Or maybe you want to do some research online first and get information from worldwide, what other experts say. So maybe another 10, 15 seconds and we'll close it, keeping the time in mind. So who are you most likely to ask for help when it comes to your osteoporosis? Okay. So 38%, almost 40%, your primary care provider, family doctor, or maybe nurse practitioner. Close second, 23, 24%, research online and your specialist doctor. And then some others going to your physiotherapist, pharmacist friend. Thank you. Thank you, Roy, for doing that. And thank you all for participating. Okay, so how can I get the most out of my doctor's visit? So kind of to summarize, patient empowerment. So you want to be empowered so you can help make the decision. So you want to participate in making the decision. But before you can make that decision, you need to have the knowledge about what decision you're making, and then some skills may be involved, be it the health literacy to able to discern the information. So hopefully in this talk, I've tried to kind of tell you what the doctor's agenda is, and I have a better appreciation of what the patient's agenda is. And hopefully when you meet with your doctor or your healthcare provider, that your agenda can overlap so you can be on the same wavelength to talk about similar issues and all to kind of achieve the same goal, to assess your fracture risk and subsequently to reduce that fracture risk, because we want to live free of fractures. Okay, so I think it's 12:55 Eastern time. Maybe a couple of minutes. We have a couple of questions, Kerry.
Yeah, sure. First, I'd like to say thank you to both you and Jackie. That was absolutely terrific. You provided so much information, and I think we can all take that information and apply it to our next physician visit. So thank you so much. We do have time for a few questions. So let's get started, and I will be asking both Adrian and Jackie for input on the questions. So here's the first. Can my GP treat my osteoporosis, or do I need to see a specialist in osteoporosis?
Excellent question. Excellent question. So osteoporosis, as you know, is a very common condition affecting men and women of all ages. And if everyone needed a specialist doctor, then there wouldn't be enough of us to see everyone. So with the recent Osteoporosis Canada guideline and for previous sets of guidelines as well, these guidelines are aimed towards primary care physicians, family doctors for treating Canadians with osteoporosis. So most osteoporosis care is done through the family doctor, and most people do not need a specialist doctor. However, there may be situations where a family doctor may not be able to manage the situation, be it complications or tricky situations. And in those situations, then your family doctor will refer you to a specialist, be it an endocrinologist, rheumatologist, or internal medicine doctor for some extra advice, extra opinion. And then sometimes seeing a specialist, you may not be seeing a specialist forever. Maybe it's just to see the specialist to get some extra advice, and then back to the family doctor for ongoing care, where your family doctor may be your quarterback of care. Now, let Jackie to see if you have anything to add to that.
Well, Adrian, in my case, for sure, my family doctor is the person that helps me manage my osteoporosis. But I have, with my doctor's input, we decided that I would speak with a specialist. And from that phone call conversation, we determined that I actually, at this point in time, for my particular case and my personal health issues, that I don't need to see a specialist at this point in time. That could change in the future, but right now it's working really well with my family doctor.
Great, thank you. I'm very cognizant of the time, so this will be the last question. What I've tried to do is combine a few questions into one, so we try to cover as many topics as possible. So, Adrian, we'll let you start. Where can I get specific advice for physical activities and nutrition relating to my bone health if my doctor can only provide me with general guidelines?
So as we mentioned before, Osteoporosis Canada's website and they have lots of resources, and it's being updated right now to reflect the new guideline just out in October 2023. New handouts about exercise, nutrition. There's nutrient calculator there as well, which is new. And there's lots of videos that's constantly put up, and webinars like today's webinar and other webinars, be it about, can I golf? Can I do yoga? How can I get enough calcium in my diet? So that will be a starting place for anyone who wants to know more about specific advice, be it about physical activity or nutrition, that's on osteoporosis. Yeah, your family doctor, some family doctors, they know a lot. They know about every medical condition. So we cannot expect them to know everything about osteoporosis and rheumatoid arthritis and everything. They know a bit about everything, which is good, which is great. So when you kind of test their knowledge about exactly which type of milk cannot I have, then you're testing their knowledge, which may be unfair to them. So if you need more specific information and our website may not have enough, then at that situation, you can ask your family doctor to refer you, maybe to a specialist like myself. But if you ask me about how can I do yoga and what poses can I do, can I not do, I may not be the person to answer that either. So in terms of nutrition, physical activity, you may be referred to the specialists in those areas. So maybe a dietitian, registered dietitian, and nutritionist for dietary recommendations. For exercise, it could be a physiotherapist, occupational therapist, and kinesiologist. These are all experts in physical activity, and some of these specialists may have additional training or knowledge, particularly in osteoporosis. So you can ask your family doctor if they know of these individuals in your area.
Jackie, did you have any thoughts to add?
What I'd like to add is as Adrian has started mentioning, don't forget that you can build a support team around you to help you with this, because your doctor won't be available or be an expert in all things. So I know, for instance, you could access a nutritionist and also a physiotherapist, and people in that related field are really great at helping navigate physical activities. And we're all different. So seeing these people and having them on your team to access makes it easier to get answers to our questions.
Terrific. So at this point, I would like to thank both Dr. Lau and Jackie for such an informative presentation. I'm sure everyone is better equipped for their next visit to their physician. For more information on osteoporosis, please visit our website at osteoporosis.ca. Our website includes many tools, including a nutrient calculator, podcasts, quizzes, and a repository of past webinars. We do have 2 upcoming events that you may be interested in: a cooking demonstration on June the 20th, and a webinar with a dietitian entitled Food for Fuel to Keep You Active on June the 25th. And finally, if you're in Moncton, consider joining our volunteer group. We will be hosting 2 educational events, one in English and one in French this fall, and we could really use some help planning the events and help on the day of registration. You can find information on our website as shown here on the slide. So with that, I'd like to say thank you again to Adrian and Jackie, and thanks to all of you for joining us today, and I hope you'll join us again soon. Have a great day, everyone. Thank you.